everyone, and welcome back to another insightful episode of MedSynapse podcast series, where we bring you experts' insights from leading voices in healthcare. I'm your host, Hetvisha, and today we are exploring one of the most promising frontiers in cancer care, which is precision oncology. With advances in molecular profiling, genomic testing, and targeted therapies, treatment is becoming increasingly personalized, moving away from traditional one-size-fits-all approach. But what does this really mean for patients and clinicians? And to guide us through this exact question and an important discussion, we have with us Dr. Raman Narang, a cancer specialist with expertise in both radiation and medical oncology. With years of experience in managing a wide spectrum of cancers ranging from solid tumors to blood-related malignancies, Dr. Narang is deeply committed to evidence-based care and tailoring treatments to the unique needs of each patient. So welcome, Dr. It is an absolute pleasure to have you alongside me today.
Thank you, Hezvi. Thank you so much for inviting me. And yes, it is a pleasure from me also to come on this platform and inform everyone about the new aspects of precision oncology.
So to start with, for our audience, how would you define precision oncology and how does it differ from traditional oncology approaches?
So, first of all, let us understand what is traditional oncology. Traditional oncology means that we act on all kinds of cells, that is both the normal cells as well as the cancer cells. And the treatment is non-specific. Yes, it definitely helps us in controlling the disease, but with some limited response. While on the other hand, precision oncology focuses on each and every individual and their unique cancer biology, which includes genetic makeup of the tumor, the specific patient genes, and other personal factors, which leads us to a tailored treatment plan. It can involve genetic makeup, molecular makeup of the patient, such as biomarkers, mutations, which can help us further in deciding whether any kind of targeted therapy, immunotherapies, or all the upcoming precision therapies are needed or not.
Correct. I think that's a very clear explanation, and I think precision oncology can also seems to shift the focus from treating the disease to individual patient also. How are molecular profiling and genomic testing changing the way we diagnose and treat cancers today, and which cancer types are currently benefiting the most from these approaches?
So if we see, a lot of research is going into cancers. And more specifically, these days, a lot of research is going into molecular profiling of the patients as well as their cancers. So these molecular tests, or we say as molecular profiling, can help us from beginning till the end. So from beginning, I mean from the early screening of the cancers, then it can help us in diagnosing and classifying cancers. So one of the most classical example of this is the brain tumors. In brain tumors, the classification is as per the molecular profiling of the tumors. This is a very typical thing which is not present in all the cancers or very few cancers. Then there's something known as tumor agnostic care. So what it means is that we treat cancers based on the biomarkers rather than the site-specific disease. So the most classic example of these is the lung and breast cancers. So in both of these cancers, a lot of biomarkers, a lot of genetic markers has come up which help us in deciding the treatment of the disease as well as how to take better care of the patient with the help of these. And another thing which is upcoming for these biomarkers or these molecular profiling is the tracking of drug resistance. So liquid biopsy do help us in, catching all these things.
I think that's so fascinating.
Definitely.
Despite these advances, what are the biggest challenges, like whether it's cost, accessibility, or technology in implementing precision oncology in routine practice?
So yes, definitely with new practices, we do face new kind of challenges. In a country like India, some of the few typical challenges that we face in precision oncology, first of all, is the obvious one, the cost. As new and new research is going on, the new and new molecules are being diagnosed, new and new techniques are being done. Yes, the cost is high. At least the initial cost is high. With time, they do get cheaper. But yes, currently, as the new drugs are evolving, the cost is quite high. Even though a lot of the companies, they do offer a lot of assistance for the needy patients. But yes, it still has a long way to go. Another very common challenge with precision oncology is the infrastructure, or you can say accessibility. Currently, most of the major cancer centers, they do have these kind of infrastructure, but a lot more labs, a lot more testing, a lot more equipment is needed in order to apply this in all the patients. Another thing is the transportation and the handling of the samples. Because of the insensitivity, I won't say insensitivity, but many are not aware how to handle these kind of specimen, how much specimens should be tested. So this many a times leads to that sample being either inadequate or the testing being inadequate. Another limitation is definitely the technical limitations. Many a times the tumor is heterogeneous. New resistance mechanisms can develop over time. And very few patients have targetable mutations. So a lot of patients we take care with the traditional oncology, and out of those, only those patients in which there are molecular markers present or biomarkers present, we treat them with precision oncology. So still it has a long way to go. We are on the verge of discovering new and new molecules every day, new and new markers every day. So yes, future will tell us how much more we can succeed in precision oncology. But currently, precision oncology is the future.
I think that's a very, very important point that you have, pointed out and to consider as well. So now, Doctor, coming to the next question, what role do you think like liquid biopsies and other non-invasive testing play in the next decade?
First of all, let us try and understand what is liquid biopsy. So liquid biopsy, they mainly test for presence of malignancy without the actual tissue. In short, they test the molecular signatures of malignancy in the human body. It can range from DNA to RNA or even at the protein level. These kind of non-invasive testing can be used either for early screening of patients, potentially for cancers in which screening protocols are currently not available. These are also helpful in diagnosing cancers when actual tissue either is inadequate or even may not be accessible for us. The current research in this field is fast growing. It is growing by leaps and bounds. A lot of things are making it into a practice right now, but still it has a long way to go. Apart from this, it can also be used for monitoring disease or presence of residual disease. So we can actually take help of liquid biopsies and non-invasive testing for all of these things.
Yeah, so I think the potential of liquid biopsies is like a game changer for both patients as well as doctors, right?
Definitely. It has already become a game changer. A lot of patients that we see in our clinical practice, many of them, they don't want to undergo that tissue proof, that biopsy again. So in these cases, we give them an option of liquid biopsies. Many a times the tissue is very small or inaccessible. Even in those cases, we can give them the option of doing liquid biopsies. So yes, it has already come a lot way, but still a long way to go also.
Like it's such a game changer, I would say. Right. So now, Doctor, finally, what advice would you give to patients and caregivers who want to explore precision oncology as part of their treatment journey?
Precision oncology is a very rapidly emerging discipline, and yes, it provides ample benefits and opportunity which was not available before. But before coming to a conclusion whether in your case it might help or not, or how much it might help, my only advice will be to consult with the oncologist who is giving them treatment. Discuss all the possibilities, all the pros and cons with them, and then reach the final decision.
Yeah, correct, Doctor. I think that's very reassuring and such a practical advice that you've given. So thank you for sharing that, Doctor. As we wrap up today's session also, thank you so much for sharing your expertise and showing us the evolving and vital area of oncology. So thank you so much, Doctor.
Thank you so much. Thank you.
And to our audience, thank you for tuning into this episode. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, take care and keep learning.